Okay, last slide here. We're going to talk about some aggravating factors for you to just be aware of. And we've talked about these a little bit already, but I just wanted to reiterate some of these things, okay? So number one, okay, is we have birth traumas, which remember happen in utero when the baby's developing inside mom, and then the medical interventions. Again, not meant to shame mom. We're not trying to shame any profession, doctor at all, right? There is a time and place for all of these procedures, but it's good for you to know as a parent, as a mom, as a dad, like what are we exposing ourselves to? What are we exposing this kid to, right? And how do we help them to heal? And so it's important to know these are all big pieces to the puzzle as we're trying to figure out where we at in the healing cycle, but also what type of therapies are going to be best and when and how, okay? Number two, okay, we have unregulated or unprocessed conflicts or traumas or emotions, okay? This is important. If we go back to think of that pyramid again, okay? As the body's developing and moving up that pyramid and getting more and more complex, trying to deal with things and work through things, when we are not working through some of these big emotional things, it kind of almost freezes the production or the productivity of the body in that pathway until that is healed. So it's really helpful the body wants to come back and revisit some of these things. I call this the Uncle Rico syndrome. A lot of times the body wants to go back and revisit this time in my life to help it to heal, which is why we get triggers, or a song comes on, or we eat a certain food and it reminds us of certain times in our life. That's by design. That's the nervous system at work trying to serve us and to help us to heal. Lastly, we have time. Good or bad, however you want to look at this, time, okay? These things that go unregulated or undealt with over time, they just kind of compound on each other. Again, going back to that pyramid, if something goes unregulated or dysregulated at the nervous system level, over time, it ripples up that pyramid and causes issues, okay? So one of the best things to do is getting treatment, but also, again, being careful with when and how we're introducing some of those things. And that's where working with a professional that works with the nervous system really comes into play and is really helpful. A fourth bonus aggravating factor here could be toxins, okay? Different pathogens that we are exposed to. That's a pretty common one that we all know about, but it's worth mentioning. Chronic illness can be a factor that kind of triggers a dysregulation in the nervous system as well. So, closing thoughts on this slide here, less is often more when you're dealing with the dysregulated nervous system. And again, it goes back into this art of like when and how that we're going to be applying certain therapies and what type.